Hello, this is Emergency Care and Transportation of the Sick and Injured, Chapter 40, Terrorism Response and Disaster Management. And you'll be learning how to coordinate with other teams, what your role is in an incident, and how to help manage multiple patients as well as the situation that you're in. As far as EMS operations are concerned, your knowledge of operational roles and responsibilities ensure patient, public, and personnel safety. Let's talk about mass casualty incidents due to terrorism and disaster. The risks and responsibilities of operating on the scene of a natural man-made disaster will also be discussed. It is possible you may be called on to respond to a terrorist event during your career. The question is not when terrorists strike again, but rather when and where they will strike. You must be mentally and physically prepared for the possibility of a terrorist event. It is difficult to plan and anticipate a response to many terrorist events, yet there are several key principles that do apply to every response. Let's talk first about what actually is terrorism. Terrorists have been at work since early days of civilization. The U.S. Department of Justice defines both international terrorism and domestic terrorism with these points. It involves a violent act or acts that are dangerous to human life, that violate federal or state law. They appear to be intended to intimidate or coerce a civilian population, and also to influence the policy of a government by intimidation or coercion, and also to affect the conduct of a government by mass destruction, assassination, or kidnapping. One difference between international terrorism and domestic terrorism is location. International terrorism occurs primarily outside of the territorial jurisdiction of the United States. Domestic terrorism occurs primarily within the territorial jurisdiction of the United States. Modern-day terrorism is common in the Middle East, where terrorist groups have frequently attacked civilian populations. In the United States, domestic terrorists have struck multiple times in previous years. Only a small percentage of groups actually turn toward terrorism as a means to achieve their goals. There exist out in the world religious and extremist groups and doomsday cults. One such group is known as Aum Shinrikyo, and you might remember them famously for the sarin attack that they perpetuated in the Tokyo subway, and a lot of people died and were seriously injured. Sarin is extremely toxic, and somehow in their mindset they thought they could influence the world and Japanese government to buy their demands. It's worth looking up because it, while being a horrific event, also demonstrates a situation hopefully you never find yourself in, but sometimes these groups can literally strike out of nowhere. So it's worth learning about past events so that you're prepared for future events, and that's kind of the basic theme that we're talking about in this chapter. Now, some of these groups, like Aum Shinrikyo, appear or participate in apocalyptic violence. There are also extremist political groups. These include violent separatist groups and those who seek political, religious, economic, and social freedom. Then there are also cyber terrorists. They attack a population's technological infrastructure as a means to draw attention to their cause. Further, there are single-issue groups. These include anti-abortion groups, animal rights groups, anarchists, racists, and even eco-terrorists. Now let's talk about weapons of mass destruction. A weapon of mass destruction, or WMD, or a weapon of mass casualty, a WMC, is any agent designed to bring about mass death, casualties, and massive damage to property, infrastructure like bridges, tunnels, airports, and seaports. Be nice and CBRNE are mnemonics to help remember the kinds of weapons of mass destruction. Be nice includes biologic, nuclear, incendiary, chemical, and explosive. CBRNE includes chemical, biologic, radiologic, nuclear, and explosive. You need to know these mnemonics. To date, the preferred WMD for terrorists has been explosive devices. WMDs are relatively easy to obtain or create and are specifically geared towards killing large numbers of people. Chemical or terrorism warfare involves chemical agents that are manufactured substances that can have devastating effects on living organisms. They can be produced in liquid, powder, or vapor form, depending on the desired route of exposure and dissemination technique. These agents consist of the following types: vesicants, which are blister agents; respiratory agents, which are choking agents; nerve agents; metabolic agents, like cyanides. Then there's biologic terrorism or warfare. Biologic agents are organisms that cause disease. They are generally found in nature for terrorist use. However, they are cultivated, synthesized, and mutated in a laboratory. The weaponization of biologic agents is performed to artificially maximize the target population's exposure to the germ. The primary types are viruses, bacteria, and toxins. Then there is nuclear or radiologic terrorism. There have been only 2 publicly known incidents involving the use of a nuclear device: Hiroshima and Nagasaki. It is possible for a terrorist to secure radioactive materials or waste to perpetrate acts of terror. These materials are far easier for a determined terrorist to acquire and require less expertise to use. Dirty bombs can cause widespread panic and civil disturbance. The difference between the two is one is a fission weapon where you have massive release of energy and heat and gamma rays and other radioactive damage. Dirty bombs it's effectively a regular bomb, but it's been laced with radioactive material. And because it disperses over such a wide area and in such minute amounts, it can cause huge amounts of economic disruption, because people don't want to go anywhere near an area that's laced with contaminant you can't see, feel, taste, and only tiny minute amounts can cause very serious illness and death. Now, EMT response to terrorism involves a lot of things. When you respond to a terrorist event, the basic foundations of patient care remain the same. However, the treatment can and will vary. Always remember situational awareness. Recognizing a terrorist event, like indicators that you pick up on, is what we're going to talk about next. The planning of most acts of terror is covert, which means that the public safety community generally has no prior knowledge of time, location, or nature of the attack. You must constantly be aware of your surroundings and understand possible risks for terrorism. You must know the current threat level issued by the federal government through the Department of Homeland Security, DHS. In April 2011, the color-coded Homeland Security Advisory System was replaced by the National Terrorism Advisory System, or NTAS. Alerts from NTAS contain a summary of the threat and actions that responders, government agencies, and the public can take to maintain safety. Make sure you're aware of information sent out by the advisory system at the start of your workday. On every call, make the following observations. Type of location. Is the location a monument, infrastructure, government building, or a religious building? Is there a large gathering or special event? The type of call. Is there a report of an explosion or suspicious device? Are there reports of people fleeing the scene? And then number of patients. Are there multiple victims with similar signs and symptoms? This is probably the single most important clue that a terrorist attack or an incident involving a WMD has occurred. Then there are victims' statements, the second best indication of a terrorist or WMD event. Were there any pre-incident indicators? For instance, has there been a recent increase in violent political activism? Are you aware of any credible threats made against the location, gathering, or occasion? As far as response actions, again, as always, your number one priority is scene safety. Remember to stage your vehicle a safe distance from the incident. Wait for law enforcement personnel to advise you that the scene has been made secure. If you have any doubt it may not be safe, do not enter. The best location for staging is upwind and uphill from the incident. And remember the following rules. Failure to park your vehicle at a safe location can place you and your partner or partners in danger. If your vehicle is blocked in by other emergency vehicles or is damaged by a secondary device or event, you will be unable to provide victims with transportation or manage to escape yourself. Now, as far as in regards to secondary devices, terrorists have been known to plant additional explosives that are set to explode after the initial bomb. This type of secondary device is intended primarily to injure responders and to secure media coverage. Secondary devices may include various types of electronic equipment such as cell phones or pagers. If you recall the shooting in San Bernardino a couple of years ago, when the police and FBI and SWAT went into the apartment of the shooters, it was rigged with a lot of explosives. So there are so many incidents out there that you need to read about, but there are often secondary devices which most of the time, fortunately, aren't stumbled upon by a member of the public, and police and SWAT, FBI, etc. know to anticipate them and send out specialized responders to respond to and disarm them. But please do study about incidents that have happened in the past. The figure on this slide shows an example of safely staging an ambulance. You see the ambulance is away from this incident. As far as responder safety, which is personnel protection, the best form of protection from a WMD agent is preventing yourself from coming into contact with the agent. The greatest threats facing you in a WMD attack are contamination and cross-contamination. Contamination with an agent occurs when you have direct contact with the WMD or aren't exposed to it. Cross-contamination occurs when you come into contact with a contaminated person who has not been yet decontaminated. Let's discuss notification procedures. You need to notify the dispatcher when you suspect a terrorist or WMD. Inform dispatch of the nature of the event, any additional resources that may be required, the estimated number of patients, the upwind route of approach or optimal route of approach. And it is extremely important to establish a staging area where other units will converge. Be mindful of access and exit routes when you direct units to respond to a location. Trained responders in the proper protective equipment are the only persons equipped to handle the WMD incident. Keep in mind that there may be more than one type of device or agent present. As the first provider on scene, the EMT may need to establish command until additional personnel arrive. You and other EMTs may function as medical branch directors, triage supervisors, treatment supervisors, transportation supervisors, logistic officers, command and general staff. And if the initial incident command system, ICS, is already in place, immediately seek out the medical staging officer to receive your assignment. It is every EMT's responsibility to constantly assess himself and reassess the scene for safety. This is an important component of situational awareness. Let's discuss chemical agents a little bit. Chemical agents are liquids or gases that are dispersed to kill or injure. The characteristics of an agent can be described as liquid, gas, or solid material. Persistent or non-volatile agents can remain on a surface for long periods, usually longer than 24 hours. Non-persistent or volatile agents evaporate rapidly when left on a surface in the optimal temperature range. With chemical agents, the route of exposure is a term that's used to describe how the agent most effectively enters the body. Agents with a vapor hazard enter the body through the respiratory tract in the form of vapors. Agents with a contact hazard or skin hazard give off very little vapor or no vapors and enter the body through the skin. Let's talk about vesicants, which are blister agents. The primary route of exposure of blister agents or vesicants is in the skin contact. However, if vesicants are left on the skin or clothing long enough, they produce vapors that can enter the respiratory tract. Vesicants cause burn-like blisters to form on the victim's skin and in the respiratory tract. The various agents or vesicant agents consist of sulfur mustard, which if you go back and study history a little bit, was used during World War I. That's mustard gas. So you have sulfur mustard, lewisite, phosgene oxime, which was also used during World War I. They are still widely available, unfortunately, in the commercial industrial market. So it's not impossible that you would encounter some of these agents, even though they were banned for the use in war. They are still available as chemical industrial agents. The vesicants usually cause the most damage to damp or moist areas of the body, such as the armpits, groin, and respiratory tract. Signs of vesicant exposure on the skin include the following: skin irritation, burning and reddening, immediate intense skin pain, formation of large blisters, gray discoloration of the skin, swollen, enclosed, or irritated eyes, permanent eye injury, including blindness, and if vapors were inhaled, the patient may experience these signs and symptoms: hoarseness and stridor, severe cough, hemoptysis, which is coughing up blood, and severe dyspnea. Sulfur mustard is a brown, yellowish, oily substance that is generally considered very persistent. As the agent is absorbed into the skin, it begins an irreversible process of damage to the cells. Mustard is considered a mustagen, which means that it mutates, damages, and changes the structure of cells. The patient will experience a progressive reddening of the affected area, which will gradually develop into large blisters. Mustard also attacks vulnerable cells within the bone marrow and depletes the body's ability to reproduce white blood cells. Sulfur mustard vapors can be inhaled, creating upper and lower airway compromise. Lewisite and phosgene oxime produce blister wounds very similar to those caused by mustard. These agents produce immediate, intense pain and discomfort when contact is made. The patient may have a grayish discoloration at the contaminated site. As far as treatment for vesicant agents, there are no antidotes for mustard or CX exposure. However, British anti-lewisite is the antidote for Agent L. However, it is not carried by civilian EMS. Ensure that the patient has been decontaminated before you initiate any treatment. If the agent has been inhaled, the patient may require prompt airway support as soon as decontamination is complete. Transport should be initiated as soon as possible. Generally, burn centers are best equipped to handle the wounds and subsequent infections produced by vesicants. Then there are pulmonary agents or choking agents. The pulmonary agents are gases that cause immediate harm to persons exposed to them. It includes chlorine and phosgene. They produce respiratory-related symptoms such as dyspnea and tachypnea. Their primary route of exposure is through the respiratory tract, which makes them an inhalation or vapor hazard. Once inside the lungs, they damage the lung tissue and fluid leaks into the lungs. Pulmonary edema develops, resulting in difficulty breathing because of severely impaired gas exchange. Chlorine was the first chemical agent ever used in warfare, and it initially produces upper airway irritation and a choking sensation. The patient may later experience these signs and symptoms: shortness of breath, chest tightness, hoarseness and stridor, gasping and coughing. With serious exposures, patients may experience pulmonary edema, complete airway constriction, and death. Phosgene has been produced for chemical warfare, as I mentioned before, and is a product of combustion as well, such as might be produced in a fire. Phosgene is a very potent agent that has a delayed onset of symptoms, usually hours. The odor produced by chemical is similar to that of freshly grown grass or hay, or green corn, if you've ever been exposed to newly grown corn. It smells also like that. The result is that much more of the gas may enter the body unnoticed. Initially, a mild exposure may include these signs and symptoms: nausea, chest tightness, severe cough, dyspnea on exertion, and pulmonary edema may be so severe that the patient continually coughs up white or pink-tinged fluid. A severe exposure produces such large amounts of fluid in the lungs that the patient may actually become hypovolemic and subsequently hypotensive. As far as treatment for pulmonary agents, the best initial treatment is to remove the patient from the contaminated atmosphere. This should be done by trained personnel in the proper PPE. Aggressive management of the ABCs should be initiated, paying particular attention to the oxygenation, ventilation, and suctioning if required. Do not allow the patient to be active, and there are no antidotes to counteract pulmonary agents. The primary goals are to perform the ABCs, allow the patient to rest in a position of comfort with the head elevated, and initiate rapid transport. If the patient's condition does not improve with basic airway support, consider requesting ALS intercept. Continuous positive airway pressure, or CPAP, may benefit some patients, but others will require advanced airway management. Now let's talk about nerve agents. Nerve agents are among the most deadly chemicals ever developed. They're classified as WMDs and are not readily available to the general public, unlike chlorine, phosgene, and some of the other gases that have been used in warfare but are now used in industrial application that I talked about. So nerve agents are not readily available to the general public. They are extremely toxic and rapidly fatal with any route of exposure. In Amish and Riccio that I mentioned much earlier in the chapter, they used a nerve agent, sarin, which is extremely lethal and highly toxic and produces rapid deterioration of the victim and death. So that's one example of a nerve agent. Nerve agents can cause cardiac arrest within seconds to minutes of exposure. Nerve agents are a class of chemical called organophosphates, which are found in household bug sprays, agricultural pesticides, and some industrial chemicals at much lower strength and than is available in a weaponized form. Organophosphates block an essential enzyme in the nervous system, causing the body's organs to become overstimulated and burn out. G agents came from the early nerve agents, and they're called the G series. Sarin, GB, is a highly volatile, colorless, and odorless liquid. LD50, which is the standard measurement that represents the amount that will kill 50% of a population exposed to this level, of about 1 drop. Especially dangerous in enclosed environments, and when it comes in contact with the skin, it is quickly absorbed and evaporates. When it is on clothing, it has the effect of off-gassing. Soman, GD, is twice as persistent as sarin and 5 times as lethal. This agent is a contact and inhalation hazard. A unique additive in GD causes it to bind to the cells that it attacks faster than any other agent. Tabun, or GA, is approximately half as lethal as sarin and 36 times more persistent. It is a contact and inhalation hazard. Then you have V-agent, or VX, which is a clear oily agent that has no odor and it looks like baby oil. It is more than 100 times more lethal than sarin and is extremely persistent. It is easily absorbed into the skin, and the oily residue that remains is extremely difficult to decontaminate. This is table 40-2, and this is a list of nerve agents. You need to become familiar with them, so if you encounter a situation where you've got patients with a lot of same symptoms, and you recognize these symptoms as to be a result of a possible nerve agent, that's something that you absolutely need to be aware of and reach out for advanced help. It may turn out that it was something other than that, but you still need to be aware of what these agents are and what they do. And just because they are not available to the general public doesn't mean that surreptitious things don't go on in the world. So you need to be aware of them, know what they are, and their signs and symptoms. Nerve agents all produce similar symptoms, but have varying routes of entry. The symptoms are described using the military mnemonic SLUDGEM, S-L-U-D-G-E-M. S is salivation and sweating. L is lacrimation, which is excessive tearing, also called rhinorrhea. Urination. D is defecation, drooling, or diarrhea. G is gastric upset and cramps. E is emesis, which is vomiting. M is muscle twitching or miosis, also with pinpoint pupils. And the medical mnemonic dumbles is also used. D is diarrhea, U is urination, M is miosis or muscle weakness, B is bradycardia, bronchospasm or bronchorrhea, E is emesis, L is lacrimation, S is seizures, salivation, and sweating. Miosis is the most common symptom of nerve agent exposure and can remain for days to weeks. It is seen quickly in vapor exposure and may occur later after isolated skin exposure. The patient may have been exposed to both. With nerve agent treatment, fatalities from severe nerve agent exposure occur as a result of respiratory complications which lead to respiratory arrest. You can greatly increase the patient's chance of survival simply by providing airway and ventilatory support. Often in patients exposed to these agents, seizures will begin and will not stop. These patients will require administration of nerve agent antidote kits. Medical treatment may include a duodote autoinjector, which contains 2.1 milligrams of atropine and 600 milligrams of pralidoxamine chloride, or 2-PAM, and it is delivered as a single dose through one needle. The military form is the antidote treatment nerve agent autoinjector, which is called ATNA. Then there are the metabolic agents, the cyanides. Hydrogen cyanide, AC, and cyanogen chloride, CK, are both agents that affect the body's ability to use oxygen. Cyanide is a colorless gas with an odor similar to almonds or bitter almonds. Effects of cyanides begins on the cellular level and are very rapidly seen at the organ and system levels. These deadly gases are commonly found in many industrial settings such as gold and silver mining, photography, and plastics processing. They are often present in fires associated with textile and plastic factories. In low doses, these chemicals are associated with dizziness, lightheadedness, headache, and vomiting. High doses will produce symptoms that include the following: shortness of breath and gasping respirations, respiratory distress or arrest, tachypnea, flushed skin, and tachycardia. Will also produce altered mental status, seizures, coma, apnea, cardiac arrest. With cyanide agent treatment, cyanide binds to the body's cells, preventing oxygen from being used. Once trained personnel wearing proper PPE have removed the patient from the source of exposure, all of the patient's clothes must be removed to prevent off-gassing in the ambulance. The patient must be decontaminated by trained personnel before initiating treatment. Support the patient's ABCs. Mild effects will generally resolve by removing the victim from the source of contamination and administering supplemental oxygen. Severe exposure will require aggressive oxygenation and perhaps ventilation with supplemental oxygen. Always use a bag valve mask, BVM, or oxygen-powered ventilator device. Initiate transport immediately if antidote by ALS is not available. Then there are the biologic agents. Biologic agents pose many difficult issues when used as a WMD. Biologic agents can almost be completely undetectable. Most of the diseases caused by these agents will be similar to other minor illnesses. Biologic agents are grouped as viruses, bacteria, and neurotoxins and may be spread in various ways. Dissemination is the means by which a terrorist will spread the agent. A disease vector is an animal that, once infected, spreads disease to another animal. How easily the disease is able to spread from one human to the other is called communicability. In instances when communicability is high, such as with smallpox, the person is considered contagious. Incubation is the period of time between the person becoming exposed to the agent and the appearance of first symptoms. Let's talk specifically about viruses. Viruses are germs that require a living host to multiply and survive. Once in the body, the virus invades healthy cells and replicates itself to spread throughout the host. Viruses move from host to host by direct methods, such as respiratory droplets or through vectors. Smallpox. Smallpox is a highly contagious disease. All forms of standard precautions must be used to prevent cross-contamination. Wear examination gloves, a HEPA-filtered respirator, and eye protection. Before the rash and blisters show, the illness will start with a high fever and body aches and headaches. A quick, easy way to differentiate smallpox from other skin disorders is to observe the size, shape, and location of the lesions. In smallpox, all the lesions are identical in their development. Smallpox blisters begin on the face and extremities and eventually move toward the chest and abdomen. The disease is in its most contagious phase when the blisters begin to form. The table on this slide lists the characteristics of smallpox. You definitely need to be aware of this. This is table 40-4. And while smallpox is considered quote-unquote dead, there are living samples of it at the CDC in Atlanta and at a lab in Moscow. The concern has been that somehow access to these agents might be compromised, or somebody has developed the ability to develop or regrow smallpox in a lab. So it's a very great concern. So definitely be aware of smallpox and its characteristics, and this again is table 40-4. Now we're going to talk about viral hemorrhagic fevers. VHFs consist of a group of diseases caused by viruses that include Ebola, Rift Valley, Marburg, and other yellow fever viruses, among others. This group of viruses causes blood in the body to seep out from the tissues and blood vessels. Initially, the patient will have flu-like symptoms, progressing to more serious symptoms such as internal and external hemorrhaging. All standard precautions must be taken when treating these illnesses. The table on this slide lists the characteristics of viral hemorrhagic fevers. Now we'll talk about bacteria. Unlike viruses, bacteria do not require a host to multiply and live. Bacteria are much more complex and larger and can grow up to 100 times larger than the largest virus. Most bacterial infections can be fought with antibiotics. Most bacterial infections will generally begin with flu-like symptoms. There is inhalation and cutaneous anthrax, which is Bacillus anthracis. Anthrax is caused by a deadly bacterium that lies dormant in a spore. When exposed to the optimal temperature and moisture, the germ will be released from the spore. The routes of entry are inhalation, cutaneous, and gastrointestinal. The inhalation form, or pulmonary anthrax, is the most deadly and often presents as a severe cold. Pulmonary anthrax is associated with a 90% death rate if left untreated. Antibiotics can be used to treat anthrax successfully. Here is 40-6, which are list the characteristics of anthrax, and it is a much more likely possibility than some of the others that we've discussed, because anthrax already exists as a veterinary disease that's commonly found in cattle, sheep, sometimes horses, but more often than cows, and that's called bovine anthrax. However, it can be transmitted to humans and other animals. The concern is that anthrax has been genetically manipulated so that it's more contagious to humans in a lab and could be potentially weaponized. So that's why we're talking about it here, and these are the classifications of anthrax and how they enter the body and so forth. Then there is plague, which is bubonic or pneumonic plague. The plague's natural vectors are infected rodents and fleas. Bubonic plague infects the lymphatic system. When this occurs, the patient's lymph nodes become infected and grow. The glands of the nodes will grow large and round, forming what are called buboes. If left untreated, the infection may spread through the body, leading to sepsis and possibly death. Pneumonic plague is a lung infection, also known as plague pneumonia, that results from inhalation of plague bacteria. This form of the disease is contagious and has a much higher death rate than the bubonic form. The figures on this slide show the plague bubo. A plague bubo or bubo at the lymph node under the arm is what you see on the left-hand portion of the slide. On the right-hand side of the slide, you see a plague bubo at the lymph node on the neck. And plague is not considered a dead disease by any stretch. It still exists. It still is transmitted by fleas and rodents. We have it much more under control than we did in the past, obviously, but it is still present. Caught early enough, it can be treated with antibiotics, but then again, the concern is because it is still out in nature that it could be altered in a lab to resist antibiotics, and that's a grave concern and why we were talking about this disease here as well. The table on this slide lists the characteristics of plague. So you definitely need to, like all the tables, become familiar with this as well. And this is table 40-7. Now we'll talk about neurotoxins. Neurotoxins are the most deadly substances known to humans. These toxins are produced from plants, marine animals, molds, and bacteria. The route of entry is through ingestion, inhalation from aerosols, or injection. Unlike viruses and bacteria, they are not contagious and have a faster onset of symptoms. Botulinum toxin is the first one we're going to talk about. It is the most potent neurotoxin, and that's botulinum, which is produced by bacteria. When introduced into the body, the neurotoxin affects the nervous system's ability to function. Voluntary muscle control diminishes as the toxin spreads. Eventually, the toxin causes muscle paralysis, leading to respiratory arrest. The table on this slide lists the characteristics of the botulinum toxin. And these, again, you also, like all the others, need to be familiar with. Now, botulism can actually be caused by food poisoning, but it also can be altered in a lab and released. So that's why we're talking about the neurotoxins. Then there's ricin. Ricin is derived from a mash that is left from the castor beans. When introduced into the body, ricin causes pulmonary edema and respiratory and circulatory failure that leads to death. The toxin is quite stable and extremely toxic by many routes of exposure, including inhalation. Signs and symptoms of ricin ingestion are as follows: fever, chills, headache, muscle aches, nausea, vomiting, diarrhea, severe abdominal cramping, dehydration, gastrointestinal bleeding, necrosis of the liver, spleen, kidneys, and GI tract. Signs and symptoms of ricin inhalation are as follows: fever, chills, nausea, local irritation of eyes, nose, and throat, profuse sweating or diaphoresis, headache, muscle aches, non-productive cough, chest pain, dyspnea, pulmonary edema, and severe lung inflammation, along with cyanosis, seizures, and respiratory failure. Treatment is supportive, includes both respiratory support and cardiovascular support as needed. And you can see from the list of symptoms, it is quite deadly and attacks multiple systems in the body. So ricin is extremely dangerous. Here is a table that lists the characteristics of ricin exposure. Other EMT roles during a biologic event are syndromic surveillance, and syndromic surveillance is the monitoring of patients presenting to emergency departments and alternative care facilities, recording of EMS call volume, monitoring of the use of over-the-counter medications. Patients with signs and symptoms that resemble influenza are particularly important. Quality assurance and dispatch operations need to be aware of an unusual number of calls from patients with unexplainable symptom clusters coming from a particular region or community. Then there are points of distribution, strategic national stockpiles. PODs are existing facilities that are established in a time of need for the mass distribution of antibiotics, antidotes, vaccinations, and other medications and supplies. These medications may be released in deliveries called push packs by the Centers for Disease Control and Prevention Strategic National Stockpile. These push packages have a delivery time of 12 hours anywhere in the country. EMTs, AEMTs, and paramedics may be called on to assist in the delivery of medications to the public. Your role may include triage, treatment, and transport. Now we're going to talk about radiologic and nuclear devices. What is radiation? Ionizing radiation is emitted in the form of rays or particles. This energy can be found in radioactive material such as rocks and metals. Radioactive material is any material that emits radiation. This material is unstable, and it attempts to stabilize itself by changing its structure in a natural process called decay. The energy that is emitted from a strong radiologic source is the alpha, beta, and gamma, X-ray, or neutron radiation. Alpha is the least harmful penetrating type and cannot move through most objects. Beta radiation is slightly more penetrating than alpha and requires a layer of clothing to stop it. Gamma rays are far faster and stronger than alpha and beta rays. These rays easily penetrate through the human body and require lead or several inches of concrete to prevent penetration. Neutron particles are among the most powerful forms of radiation. Neutrons easily penetrate through lead and require several feet of concrete to stop them. The figure on this slide shows what effect the four types of radiation, alpha, beta, gamma, and neutron, how they enter the body, how they react to clothing and protection, and so forth. So it gives you an idea of which ones are the most destructive. Sources of radiologic material. Radiologic materials are generally used for purposes that benefit humankind, such as medicine, killing germs in food, which is irradiating food, construction, and once radiologic material has been used for its purpose, the material remaining is called radiologic waste. These materials can be found at hospitals and healthcare facilities with radiology departments, colleges and universities, nuclear power plants, chemical and industrial sites. Then there are radiologic dispersal devices, or RDDs. An RDD is any container that is designed to disperse radioactive material. A dirty bomb carries the potential to injure victims with not only the radioactive material but also the explosive material used to deliver it. I mentioned them a little bit early. The destructive capacity of a dirty bomb is limited to the explosives that are attached to it. The dirty bomb is a relatively ineffective WMD, but it does have a lot of psychological stress and economic disruption possibility. Now let's talk about nuclear energy. Nuclear energy is artificially made by altering or splitting radioactive atoms. The result is an immense amount of energy that usually takes the form of heat. Nuclear material is used in medicine, weapons, naval vessels, and power plants. Nuclear material gives off all forms of radiation, including neutrons. Now let's talk about nuclear weapons. Nuclear weapons are kept only in secure facilities throughout the world. The likelihood of a nuclear attack is extremely remote. Since the collapse of the former Soviet Union, the whereabouts of many small nuclear devices, however, are unknown. These small suitcase-sized nuclear weapons are called Special Atomic Demolition Munitions, or SATMs. Some of these are believed to be missing. Let's talk about symptomology with radiologic or nuclear devices. Patients exposed to a known or suspected source of excessive radiation are considered victims of acute radiation toxicity. The effects of radiation exposure will vary depending on the amount of radiation that a person receives and the route of entry. Radiation can be introduced in the body by all routes of entry, as well as through the body, which is irradiation, like the rays that we talked about earlier. If they have a gamma ray or neutron ray exposure, then it literally is just rays that go straight through the body. So all routes of exposure and entry can occur with radiation. Some common signs of acute radiation toxicity are listed in Table 40-11. And this is Table 40-11. This talks about common signs of acute radiation toxicity. You have low exposure, moderate exposure, and severe exposure. Now let's talk about medical management. Being exposed to a radiation source does not make the patient contaminated or radioactive. However, when patients have a radioactive source on their body, they are contaminated and must be initially cared for by a hazmat responder. Once the patient is decontaminated, you may begin treatment with the ABCs and treat the patient for any burns or trauma. Wear appropriate PPE. Secure in plastic bags any body fluids that are obtained from the patient. Place all body fluids with containers and properly dispose of them with other potentially radioactive waste. As far as protective measures, there are no suits or protective gear designed to completely shield you from radiation. The best ways to protect yourself from the effects of radiation are time. In other words, the less time that you are exposed to the source, the less the effects will be. If you realize that the patient is near a radiation source, leave the area immediately. Then there is distance. Radiation is limited in how far it can travel. Depending on the type of radiation, often moving only a few feet is enough to remove you from immediate danger. Make certain that responders are stationed far enough from the incident. Then there is shielding. Always assume that you are dealing with the strongest form of radiation and use concrete shielding between yourself and the incident. Now we're going to talk about incendiary and explosive devices. Incendiary and explosive devices come in various shapes and sizes. Incendiary devices are weapons used to start fires, and terrorists use flamethrowers, chemicals, Molotov cocktails, or other explosive devices. It is important for you to be able to identify an object you believe is a potential device, notify the proper authorities, and safely evacuate the area. Remember that there is the possibility of a secondary device when you are responding to a scene. Now we'll talk about mechanisms of injury. The type and severity of wounds primarily depend on the patient's distance from the epicenter of the explosion. Blast injuries occur in a number of ways. You have primary blast injury, which is due solely to the direct effects of the pressure wave on the body. The injury is seen almost exclusively in the hollow organs of the body. An injury to the lungs causes the greatest morbidity and mortality. Then there's secondary blast injury, which is penetrating or non-penetrating injury that results from being struck by flying debris. Objects that are propelled by the force of the blast and strike the victim, causing injury. Then there's tertiary blast injury. This results from the whole body displacement and subsequent traumatic impact with environmental objects. Other indirect effects include crush injury from the collapse of structures. And then quaternary blast injury is any other injury caused by a blast, including toxic inhalation of combustion gases, burns, a medical emergency like a myocardial infarction sustained while fleeing the scene of an explosion, and even a mental health disorder that develops immediately after or days to weeks after the detonation of an explosive device. The physics of an explosion we're going to discuss briefly. When a substance is detonated, a solid or liquid is chemically converted into large volumes of gas under high pressure with resultant explosive energy release. This generates a pressure pulse in the shape of a spherical blast wave that expands in all directions from the point of explosion. Flying debris and high winds commonly cause conventional blunt and penetrating trauma. The tissues at risk are hollow organs such as the middle ear, lungs, and GI tract, and these are the most susceptible to pressure changes. The junction between tissues of different densities and exposed tissues such as the head and neck are prone to injury as well. The ear is the organ system most sensitive to blast injuries. The patient may report ringing or pain in the ears, or some loss of hearing, and blood may be visible in the ear canal. Primary pulmonary blast injuries occur as contusions and hemorrhages. Patients may report tightness or pain in the chest and may cough up blood and have tachypnea or other signs of respiratory distress. There can be also subcutaneous emphysema over the chest that may be palpated, indicating the presence of a pneumothorax. Pneumothorax is common and may require emergency decompression. Solid organs are relatively protected from shockwave injury, but may be injured by secondary missiles or a hurled body. Hollow organs may be injured by similar mechanisms as lung tissue. Petechiae to large hematomas are the most visible sign. According to the CDC, blast lung is the most common cause of death from blast injury. Neurologic injuries and head trauma are also common causes of fatality from blast injury. Subarachnoid and subdural hematomas are often seen. Permanent or transient neurologic deficits may be secondary to concussion, intracerebral bleeding, or air embolism. Their instant but transient unconsciousness with or without retrograde amnesia may be initiated. Bradycardia and hypotension are common after an intense pressure wave from an explosion. Extremity injuries, including traumatic amputations, are common, and patients may die of massive hemorrhage without the rapid application of a tourniquet. Okay, let's go through our review questions. We covered a lot in this chapter, and there are a lot of tables you need to go back and review. And we'll go through the review questions now to help you focus in on some of the most important things that we talked about. However, in this chapter, really, as in all chapters, everything is important. But we're going to hit some of the highlights with the review questions. So question number 1, what type of terrorist group would most likely bomb an abortion clinic? A, a single issue group. B, technology terrorist. C, extremist political group. Or D, violent religious group. I think you probably already know the answer. The answer is A, single-issue terrorist group. As their name implies, focus on single issues. They include anti-abortion groups, animal rights groups, anarchists, racists, or even eco-terrorists who threaten violence as a means to protect the environment. Let's go over the incorrect answers. Again, the correct answer is a single-issue group in terms of what type of group would most likely bomb an abortion clinic. Then let's talk about the incorrect answers. Technology terrorists, that's incorrect because technology terrorists would attack the technology infrastructure. Extremist political group is incorrect because an extremist political group seeks political, religious, economic, and social freedom. Or D, a violent religious group, and that's incorrect in this case because violent religious groups, also known as doomsday cults, may participate in apocalyptic violence. Number 2, the term weaponization is defined as A, the period of time that a chemical agent will remain on a given surface before it evaporates. B, the method or mechanism by which a terrorist or terrorist group delivers a chemical or biologic agent. C, the cultivation, synthesization, and or mutation of an agent in order to maximize the target population's exposure. Or D, the detonation of an explosive device utilizing an item that is inconspicuous, such as a briefcase or suitcase. If you just read through these answers carefully, you'll get the right answer. And it is C. Weaponization is the creation of a weapon from a biologic agent generally found in nature that causes disease. For instance, I talked about the synthesization of bubonic plague into a weapon. So it's found in nature, but again, the concern is that it could be altered in a lab to resist the antibiotics we fight it with now, and the result would be, of course, catastrophic. The agent is cultivated, synthesized, and or mutated to maximize the target population's exposure to the agent. So it isn't just plague, it's the creation of any weapon from a biologic agent generally found in nature that usually causes disease already. Let's look at the incorrect answers. The term weaponization is A, the period of time a chemical agent will remain on a given surface before it evaporates. That's incorrect. This is the definition of persistency and volatility. B, the method or mechanism by which a terrorist or terrorist group delivers a chemical or biologic agent. That's incorrect. This is dissemination, not weaponization. C, the cultivation, synthesization, and or mutation of an agent in order to maximize the target population's exposure is, of course, the correct answer. And D, the detonation of an explosive device utilizing an item that is inconspicuous, such as a briefcase or suitcase. That's flat out just not the correct answer. So you definitely need to know your definitions: dissemination, persistence, etc., weaponization. You need to know those definitions. 3, the Department of Homeland Security posts a daily advisory system to keep the public aware of the current terrorist threat level. What does an orange level indicate? Now, we didn't talk about this specifically in the lecture that I just gave. However, it is in your text, and you are responsible for everything in your text. So, let's go over this. The Department of Homeland Security posts a daily advisory system to keep the public aware of the current terrorist threat level. What does an orange level indicate? A, low or low risk of terrorist attack. B, high risk of terrorist attack. C is severe, which is severe risk of terrorist attack. Or D, elevated, which is significant risk of terrorist attack. Let's look at the answer. It is B. According to the Department of Homeland Security, or DHS advisory system, the color orange indicates a high risk of terrorist attacks. Red is the highest level, indicates a severe risk of terrorist attacks. Yellow is elevated and indicates a significant risk of terrorist attack. Blue is guarded and indicates a general risk of terrorist attacks. And green indicates a low risk of terrorist attacks. So make sure you go in your text, review this system, and know what color means what level of threat. And I just went over all of these, so I'm not going to review them again here. But then again, do go and make sure you are aware of not only which color represents what level of potential threat, also remember that you need to know this every day before you head out. 4, you are dispatched to a bombing along with 15 other ambulances. Upon arriving at the scene, you should stage your ambulance A, as close to the bombing site as possible, B, upwind and uphill from the bombing site, C, downwind and uphill from the bombing site, or D, upwind and downhill from the bombing site. This one should be pretty easy. The answer is B. As with any hazmat incident, you should stage your ambulance uphill and upwind from a bombing site. A hazardous chemical may have been released during the bombing. Remaining uphill and upwind from the incident site will minimize your risk of exposure. And I'm not going to review the incorrect ones because we you always only need to remember what the correct one is, and that is uphill and upwind from a bombing site. There's always a potential for hazmat to be released, or there could be hazardous materials in the area that have begun to leak as a result of a bomb explosion. So always be uphill and upwind from the bombing site. And again, I'm not going to review these, just remember the correct one, uphill and upwind. Number 5, a terrorist would most likely use a secondary explosive device, A, to ensure that a structure is completely destroyed, B, in case the primary explosive device fails to detonate, C, as a means of dispersing a biologic or chemical agent, or D, to injure rescuers and gain maximum public attention. If you think about, we talked about primary and secondary, and who handles, well, the general public becomes victim to the primary, but who is most likely to be injured from the secondary? If you remember that we went over earlier in the chapter, then you'll get this answer correct. It is D. A secondary explosive device is usually aimed at injuring or killing rescue workers. It is also designed to be caught on camera by the media, which draws public attention to the terrorist. Biologic or chemical agents can be dispersed by the primary device or the secondary device, or both. Let's look at the incorrect answers. The terrorist would most likely use a secondary explosive device, A, to ensure a structure is completely destroyed. That's not the most correct answer, because the building will be destroyed by the first explosive device if that is the intention of the terrorist. B, in case the primary explosive device fails to detonate. Generally, a secondary explosive device is not usually needed for this reason. C, as a means of dispersing a biologic or chemical agent. Well, these agents can be dispersed in either a primary or secondary device, but the secondary device is not the exclusive means of dispersing a biologic or chemical agent, which is why this is not the most correct answer. D, to injure rescuers and gain maximum public attention. That is the correct answer. Number 6, when assessing a patient who is exposed to a vesicant agent, you should expect to encounter A, skin blistering, B, loss of hearing, C, vomiting blood, or D, profound bradycardia. If we remember vesicant agents, what they are, and how they attack the body, I think you'll get this one. The answer is A. Primary exposure route of vesicant agents, so-called blister agents, is the skin. Vesicants usually cause the most damage to damp or moist areas of the body, such as the armpits, groin, and respiratory tract. Signs of vesicant exposure on the skin include irritation, reddening, and burning, with immediate intense pain, and the formation of large blisters, among others. When assessing a patient who is exposed to a vesicant agent, you should expect to encounter, and we covered A, which is correct, skin blistering, B, loss of hearing. Vesicant agents don't cause hearing loss, but they will cause blindness because your eyes are moist. So mustard gas in particular is kind of sticky and is notorious for causing blindness. C, vomiting blood. A vesicant agent will cause a patient to cough up blood, but not be vomiting blood. And profound bradycardia, that's just incorrect, period. Question 7. What does sulfur mustard do to the cells within the body? A, it makes the cells retain water until they explode. B, it causes the cells to release all their energy, which causes cellular death. C, it makes the cells mutate, which damages and changes the cells and causes cellular death. Or D, it makes the cells release all their fluids and causes severe hydration until cellular death occurs. If you think back when we talked about what sulfur mustard or mustard gas, as is more commonly known, does to cells within the body, then you'll remember this one. And it's also why people exposed to mustard gas, for instance, World War I veterans that were exposed, suffered a lifetime of health problems if they were lucky enough to survive the initial attack. And it is C, sulfur mustard agent H causes the cells to mutate, which changes the structure of the cell so it can no longer perform its functions within the body. This causes cellular death, which can lead to the end, which is organ failure. So it depends on the amount of exposure. the victim, if they're lucky enough to survive, are going to suffer from a lifetime problems because they've had cellular change, and it's permanent. Or if they've had a massive exposure, then it's going to just change the structure of the cell in multiple systems, so they can not function normally, and boom, you've got cellular death on a massive scale, which leads to organ failure. I'm not going to go over the incorrect answers because it's more important that you remember the correct answer, which is what sulfur mustard does to cells within the body. We know that A and B are incorrect, and we know that C is the correct answer. Sulfur mustard makes cells mutate, and eventually that can lead to organ failure and massive organ failure and death. And D, we know, is not correct. 8. Pinpoint pupils, vomiting, bradycardia, and excessive salivation are signs of exposure to A. leucite, B. soman, C. cyanide, or D. phosgene. We went over these. We went over a lot, which is why I said you have a lot to review. But if you recall what we talked about just not too long ago, you'll get this correct answer. It is B. soman, which is also known as GD. It's a nerve agent. It can cause death within seconds to minutes of exposure. The mnemonic dumbbells can help you recall the signs and symptoms of a nerve agent exposure. It stands for diarrhea, urination, meiosis, which is pinpoint pupils, bradycardia, bronchospasm, emesis, which is vomiting, lacrimation, excessive tearing, and salivation, seizures, and sweating. Let's see, pinpoint pupils, vomiting, bradycardia, and excessive salivation are signs of exposure to leucite. We talked a little about leucites earlier. They produce blister wounds similar to mustard gas, so we know that's not correct. B. soman, that's the correct answer. C. cyanide, that causes tachycardia, tachypnea, and flushed skin. We know that's not correct. And D. phosgene causes nausea, chest tightness, severe cough, and dyspnea. Pinpoint pupils and bradycardia, excessive salivation, and excessive tears, that should be a dead ringer for exposure to a nerve agent. It also can produce seizures, and people become incontinent. They lose control of their bladder. So if you see these signs, it's a nerve agent. And for this list specifically, we're talking about GD, which is a nerve agent. Number 9, you respond to a plastic factory where numerous people are present with shortness of breath, flushed skin, and altered mental status. One of the patients tells you he smells almonds. He smelled almonds before he started feeling sick. These people were most likely exposed to A. sarin, B. bleach, C. cyanide, or D. chlorine. Cyanide is very distinctive, so this one should jump right out at you. It is C. Cyanide is a colorless gas that has the odor of almonds. Some people say bitter almonds, which are like toasted almonds. It is produced in many different industries in the United States, such as plastic processing, gold and silver mines, and photography studios. You should suspect a chemical exposure whenever multiple patients present with the same or similar symptoms. Let's look at the incorrect answers. They smelled almonds before starting to feel sick. So you're given an option A, which is sarin, and we know that's not correct because sarin is colorless and odorless. B, bleach. Bleach, you've used it. It definitely doesn't smell like almonds. C, cyanide is of course the correct answer, and D, chlorine. Chlorine smells like bleach, which that's why bleach is called chlorine bleach, because it's bleach has chlorine added. So chlorine definitely has the distinct odor of bleach, and actually it's bleach is part chlorine, and then it's diluted greatly for us to use in the home, but it's still very dangerous even at home. But it doesn't smell like almonds. Okay, question 10. Factors that have the greatest impact on the severity of radiation exposure include A, age and overall health, B, gender and wind speed, C, the method of dispersal, or D, time, distance, and shielding. This one you need to know. We have a lot of radiation sources out there that could potentially even just, you could be injured as a result of a fire in a facility that has nuclear medical facilities, things like that. So you need to know what are the factors that have the greatest impact on severity of radiation exposure. They include all the following. You should remember this one. It is D. The best way to protect yourself from effects of radiation is to use time, distance, and shielding. Radiation has a cumulative effect. The less time you're exposed, the less the effects will be. Radiation is also limited in how far it can travel. Depending on the type of radiation, moving only a few feet may be enough to remove you from immediate danger. The path of all radiation can be stopped by a specific object. In other words, alpha rays can be stopped by a newspaper, beta rays by your clothing, gamma rays by several feet of concrete, neutron rays, you need to be a long way away because they can even penetrate concrete. But it's least likely you'd be exposed to a neutron radiation source. So the factors that have the greatest impact on severity of radiation: A, age and overall health. It doesn't matter. Radiation can affect anyone. It doesn't matter what age you are. B, gender and wind speed. Males and females experience these same effects. Radiation affects the organism in the same way. It doesn't matter if you're male or female, and that's true for humans, animals, even plants. They all have specific reactions to radiation. It doesn't matter what sex you are. C, the method of dispersal. That's not the most correct answer because the type of radiation, alpha, beta, or gamma, has the greatest impact on the human body. Alpha is lowest, gamma is highest. Nevertheless, you want to limit your exposure to any level of radiation. So the correct answer is time, distance, and shielding. And we covered that when we talked about the answer that is correct. Thank you for all of your close attention on this very difficult subject. These are all things that you might encounter. Fortunately, not things you're likely to encounter. However, you literally never know. So it is very important that you know everything in this chapter. Make sure you review all the tables. You're familiar with biologics that can be synthesized into weapons, know the effects of radiation, etc. So again, thank you for all your attention. We'll see you next class. And make sure if you have any confusion about anything that you contact your instructor.